Bariatric surgery. It's a weight loss surgery that reduces the size of the stomach of people who need to lose weight, a lot of it. In Health Watch, Shelley Botat has the inspiring story of how Aurora BayCare Medical Center's program helped one man lose 500 pounds.
37-year-old Kevin Botesi is enjoying living a healthy lifestyle.
Life is immensely better. Like, I'm going on hikes, I'm seeing places that I never would have thought I would see again.
3 years ago, Kevin weighed 740 pounds. He had high blood pressure, pre-diabetes, and sleep apnea.
I was basically sitting in my bed all the time, so it was really depressing, and I was missing, kids' functions. I wasn't making it to their games because I was, I'd be like, oh, I can't walk that far.
The breaking point when he went into respiratory failure due to his weight. Kevin was in the hospital surrounded by his 3 kids.
My whole family's here saying their goodbyes to me because they didn't think I was going to make it.
Kevin knew he had to change his life.
You don't want your kids to experience that kind of feeling, losing their, saying goodbye to their dad, when there's absolutely something I could do about it.
So he turned to bariatric surgeon Daniel McKenna at Aurora BayCare Medical Center Bariatrics, wanting a Roux-en-Y gastric bypass surgery.
Making the stomach smaller or rerouting food past part of the stomach in order to induce a state of a lack of appetite.
I heard that was a big success.
Before Kevin could get the surgery, he had to lose some of the weight.
Kevin was so large that we needed to shrink his liver in order to be able to see his stomach and perform his surgery safely.
The hospital helped him with nutrition education, and he started to exercise.
The education beforehand is what we provide them to make sure that when they're home alone, they're eating the right foods.
I was working out 2-3 hours a day in the pool. I was eating everything I'm supposed to be. So
A year later, Kevin was down to 490 pounds, but the weight loss was slowing down, so Kevin was ready to get gastric bypass surgery.
I still had the struggles of temptations and stuff like that. I would still feel hungry.
When they have this tool there where they don't feel hungry and they feel full quicker, they can lose a substantial amount of weight.
After surgery, Kevin had to make adjustments.
You have to eat even smaller portions of what you were eating before, and and the weight was just flying off again.
Dr. McKenna says they expect most patients to lose about 70% of their excess weight, so there are many health advantages.
It puts diabetes into remission in sometimes between 75 to 85% of patients. It treats sleep apnea, hypertension, gastroesophageal reflux disease.
Today, 2 years after surgery, at 240 pounds, Kevin is nearly at his goal weight and doing things he never could before.
Now I'm rock climbing.
Kevin says his weight loss journey to a healthier self was hard, but very much worth it, being there for his 3 kids.
No more high blood pressure, no more pre-diabetic. Every weekend we're doing something. Every weekend we're hiking, we're swimming.
Like any surgery, there are risks, but Dr. McKenna says they are relatively low. He says commitment and yearly follow-up visits are very important so people do not gain weight back. To learn more, you can call Aurora BayCare or email healthwatch at aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.
Spinal surgeons are using 3D printers before complicated operations to get it exactly right. Tomorrow in Health Watch, more on how this is helping scoliosis patients.